working in like local health departments, like I've learned, the politics. I've learned, that things take time, but I've also learned that it's very rewarding. So being part of these agencies that, utilize public funds to implement programs, like it's amazing because it's like the money that we invest in taxes is being poured right back into the community through these public health programs. And so that's why I enjoy working for the government, because all of the resources and money that's being invested through taxes or just through other funds is being poured right back into the community. So the community is not losing anything when they work with the health department or when we work with them. Like there's actually a gain and there's actually an exchange, and it's mutual. So everybody's benefiting, we're all benefiting from working with each other. We're all learning from each other. And that's why I enjoy working for local health departments, because we really take what the community pours into us and we pour it right back into them.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 83. Hi everyone, Omari Richards here. Thank you all so much for joining me. I hope that you all are doing well. Before anything, be sure to follow me on Instagram. That's at the PH Millennial. Be sure to subscribe to this podcast if you have not as yet. Subscribe if you're watching this on YouTube. Leave a like, leave a review, and then be sure to share with a friend. It really helps the show get out to more people. If you'd also like to support, you can go to buymeacoffee.com/the PH Millennial, as well as the phmillennial.com/support. I really enjoyed today's episode from this guest, and I love her insights on working in 3 different local public health departments, as well as who taken on a lot of opportunities that were not there for her while she was growing up during undergrad. And I think there's a good framework to look at undergrad and see how you can take on these types of opportunities that she was able to have. But yeah, I hope you all enjoyed today's episode. Peace. Today, we have a highly energized public health professional who has over 7 years of experience in public health, working for 3 different local public health departments. She got her Bachelors of Arts in Biology at University of Virginia. She got her Masters of Public Health at CUNY Graduate School of Public Health and Health Policy. She works as a community developer at Prince George County's Health Department. We have Jasmine Drake, MPH. Welcome to the show.
Thank you for having me.
It's my pleasure. It's my pleasure. Just glad to get more people on the show. I'm looking forward to hearing more about your experience and the things that you've done in the 3 different local public health departments and just takeaways from that experience. But tell me, how are you and how you've been coping during the pandemic?
So in terms of coping with the pandemic, it's been a very interesting experience. I find that I've been able to really understand public health on a different lens. I'm really being able to understand myself and how I stay healthy during this time, particularly because things have, slowed down due to the pandemic when it comes to going out, when it comes to socializing. And so I've actually used the opportunity to fully understand myself in terms of my own health. And in addition to that, I also, when it comes to the work that I do, I noticed that there has been definitely a modification in the platforms that we're using, the marketing that we're using to get our programs, publicized. And so there's definitely been some adjustments and changes, but I think I've been able to cope really well with the pandemic, particularly because we were able, in my current health department, we were able to still implement our programs despite not being able to go in person. And then for me, I've definitely had a lot more time to kind of reflect and actually incorporate some self-care. So I've been going to the gym more, cooking more, because I'm not going out to restaurants as much due to the pandemic. And it's definitely changed my life for the better.
Okay, that's awesome. And I was going to ask you in that vein of like getting things better and I guess getting into a better schedule, as well as it setting up some time for you to really reflect what were those things? And you stated all of them, like going to the gym and other things like that. Is there anything else that you wanted to share about like your self-care or things that you reflected on during the pandemic?
I definitely reflected on just how I use my time. I noticed that, me being from New York, like I'm so used to the hustle and bustle. I'm so used to always having something to do and kind of almost like, I'm investing my time in my work. I'm investing my time in other people. And I realized when things slowed down, I said, wait, I have a lot more time to really focus on myself. And so it's always a balance. I think, with the talents and gifts that I have, like it's important to pour those back into me just as much as I pour them out to other people. And so the pandemic really caused me to reflect on how am I making sure that, the talents and gifts that I'm giving out to others, I'm also giving out to myself, and that I'm using my time appropriately because, again, now I have more free time. Now I have more time to think. Now I more have time to plan. Now I have more time to think about my future. And so the pandemic definitely was a time of deep self-awareness and deep self-reflection. And I'm really, for some people, I'm very careful to say that the pandemic was a blessing because for some people, there's been a lot of loss. And for some people, there's been a lot of gain. And I can say for me, I dealt with both. I dealt with loss in terms of certain habits and certain behaviors, but I dealt with gain in terms of certain habits and behaviors. And so I didn't lose any people personally through death, but I definitely had losses in terms of the type of behaviors that I was engaging in, eating out a lot at restaurants and, always going certain places. Now I'm more like, okay, I'm in the house more and I'm cooking more, like I'm spending more time with myself. And I never was really able to do that. Growing up in New York, you're always around a lot of people. And, I grew up in a single parent household. It was me, my brother, and my sister. And so I was always around people. And during this pandemic, like I moved into my own apartment and I live by myself now. And it was just like, wow, like I have so much more time to myself. And this is a new behavior. This is a new habit. Like I have to learn how to enjoy my own company and learn how to use all the talents and gifts that I have to pour back into myself. So I definitely learned a lot during the pandemic. And again, I had a lot of losses, but I also had a lot of gains.
Thank you. I appreciate that answer. And I think firstly, like it's very important to highlight that you realize that you have to take care of yourself because you're pouring out energy into other people, into work, into all these other things. But to ensure that you're doing that to the best of your ability, you need to pour into yourself first. And then I definitely do also believe that the pandemic has been like a blessing for me as well, just to sit back and reflect and learn about myself more and also think about, as you said, we got a lot of time and time with ourselves for a lot parts of this last 2 years. So yeah, I think for some people who have been able to sit down and actually reflect and think about like, what are the things that I have been doing? What are the things that I need to do to get me where I need to be? And what are those habits and things that I just need to do? And I think that's important to highlight. But yes, it has also been a very sad time. But yeah, okay. Thank you for sharing all of that. How do you identify, and then tell us a little bit about your personal background?
Okay, so I identify, in regards to my identification, do you, just to clarify, do you mean like in terms of demographics? Do you mean in terms of my public health experience?
I leave it as an open question, as a public health open question. People usually start off with like the pronouns and then maybe like demographics and then going into a little bit about their background.
Okay, great. So I identify as a she, as a her, and I also identify as an urban African-American spiritual woman. And so for me, like my background, I grew up in the South Bronx. I grew up in Morrisania, which is the poorest congressional district of the United States of America. And in that experience, I, really always enjoyed, learning, but also I cared about people. And so originally, like I wanted to become a medical doctor because I noticed that when I would go to, get health services at the local clinic in my neighborhood, I wasn't really comfortable with experiences. And I said, I really want to change this. I really want to, actually like be a part of the healthcare system where I make changes, and, I'm in a clinical setting where I can really be there for patients. And because I didn't always have the most comfortable experience, especially given that I was overweight. And so when I would visit the doctor, they would say certain disparaging comments about my weight. And I was a child, and they would say, well, why aren't you eating this? And I'm like, why are you asking me that? Like, I'm the child, like, I'm not, buying the food, right? Like, I'm being fed the food. And so there was a little bit of a lack of cultural competency that I noticed in the clinical setting. And so I said, I want to be a doctor. Like, I want to be a medical doctor and make these changes, because I experienced it at a young age and realized that, I really want to make these changes. But then when I went to college and, I was taking my science courses, because I was majoring in biology, they were somewhat challenging. Some courses I enjoyed, some were a bit more challenging. And I had an experience where I went to do an alternative spring break in the Dominican Republic in 2011. And what I noticed was that there was a clinic that we were doing, an educational clinic for kids who needed dental education. And when I spoke to the kids, I asked them, well, where are these cavities coming from? And, they were saying, well, we don't brush our teeth as much. And the doctor would only visit the village in Dominican Republic. He would only visit the village once a year. So the question I had was, well, if they're only visiting a medical doctor once a year, how are they learning how to stay healthy? How are they learning how to, brush their teeth? And what we did was we gave these kids a tablet, and the tablet revealed, like when they chewed it, it revealed where the cavities were in their mouth. And so if the color, it was a white tablet, but if it turned pink, that meant that they had cavities. And so I noticed that some of these children had cavities in their mouth because the tablet turned pink. And that was the question I had. Well, how are they staying healthy if, if they're only visiting a doctor once a year? Where are they learning their health behaviors from? And from then on, I decided that I no longer wanted to be a medical doctor. I wanted to pursue public health. I wanted to pursue health education and developing programs that educate people about how to stay healthy. And so I always had an interest in helping people and, caring about people in a healthy way, especially because of my experiences with being overweight. But I realized that being a medical doctor, I may not be able to impact as many people as I would like, because I'm only visiting patients one-on-one. I'm not infecting the masses. I'm not affecting groups. And in public health, you're affecting groups of people, masses of people. In a clinical setting, when you're a medical doctor, you're doing one patient at a time. And so I said, I want to affect more people. I want to have an impact on more people. So let me pursue public health. And that's really how my interest started. That's where my background is. Growing up in an urban environment, like I saw a lot of health disparities in the South Bronx, lack of, nutritious food, parks weren't safe. So I couldn't always go to the park to do physical activity because you never knew if some dangerous activity was going to happen. I remember riding my bike and I was on the concrete. I wasn't even in the grass. So it just was a lot going on where there was a lack of access to healthy opportunities in the South Bronx.
Okay, well, thank you for sharing that. And I'm definitely gonna jump back and ask some of the points of the things that came up there a little bit further down in your journey. But I appreciate that. I also appreciate you saying like you're an urban, like because you're from the city and you've seen like the issues that are in the city. And but yeah, I appreciate everything you said there. So before we jump into like your bachelor's and going to school for biology and wanting to become a doctor, what does public health mean to you?
Public health to me means opportunity to be healthy. It means that people have an opportunity to access knowledge, to access resources that allow them to live healthy lives. Public health to me means there are shared opportunities for people to share knowledge. There's a sense of community. When I think of the public, I think of community, I think of support. I don't think of public on an individual basis because that's not what the term means. Yes, you can be an individual, but we are all part of a network. So when I think of public health, I think of every individual being a part of a network that creates a healthy society and a healthy community in general. In order to be a healthy community, you have to be a healthy individual. You have to be able to have healthy mental health, a healthy physical body, healthy communication, healthy, healthy knowledge. Just everything has to be a part of your well-being and your awareness. So if you're not a healthy individual, then you cannot contribute to a healthy community. You can't be a part of a healthy community. And so I think of it as a collective. I think of public health as a collective. I think of it as a unit where people get to really share knowledge and really improve each other's health. We all get to improve each other's health by being healthy individuals.
Yeah, I love that. And I think the pandemic especially has shown just how much of a network and how connected we are, as well as like the disconnectedness of that we have lost like a lot of community ties, but that has been reborn in like this virtual world, which will be interesting to see what the implications for that are into the future. But okay, so you're coming from the Bronx. You say that you want to become a doctor, and you decide to get your Bachelors of Arts in Biology at the University of Virginia. So is there any more in that thought process besides everything that you shared earlier that you wanted to share about choosing the school and going for biology?
Yes. So the reason why I went for biology is because I always did well in my science courses in high school. And I was always fascinated with life and the body. So I felt like if I had that foundation for understanding how the body works, and I could understand how life in general works, I could understand how people behave, I can understand how people interact. Like it was a good foundation for me understanding just health in general, how health works. And so that's why I pursued biology. In terms of the coursework, there were different biology courses that I took. Some I enjoyed, some were challenging. I know I definitely enjoyed my courses like in immunology, principles of nutrition. Like those were courses that I really enjoyed in biology. Then there was others like genetics where I was like, okay, this is a bit challenging. Like this is in the nitty gritty, this is deep. And it was a bit challenging. I can be honest and say I didn't do as well in those courses, but there was some courses that I did well and that I really enjoyed. And I appreciated biology because even though I'm no longer pursuing, a science because I decided to do public health, I really appreciated having biology as a foundation for understanding how life works, for understanding how nature is, for understanding how people are. Biology was an excellent foundation in terms of understanding just exactly like how life works and how we contribute to life. So I'm grateful that I pursued biology as a major, and I'm grateful I made the transition to public health once I graduated with my undergraduate degree in biology.
Okay, got you. Well, thank you for sharing that. So during your time in undergrad, you were a program assistant at the Loma Sunbird International Center. Tell me a little bit more about that experience.
So that was, oh my gosh, that experience was amazing. As a program assistant at the Loma Sunbird International Center, I had the opportunity to meet hundreds of international students, hundreds of, community members of Charlottesville, hundreds of students. What we did was we implemented programs that provided some sort of education and social interaction in the sense of community to people who wanted to learn about other cultures. So we did a variety of activities from like cooking classes to watching movies, to doing presentations, to doing hiking and picnicking. Like we had various activities that allowed people to come together. We had language classes. So there was some classes where you could learn a different language. So there was some programs where you could learn a different language. But what I really enjoyed the most were the cooking classes, because as a program assistant, not only did I oversee the classes and make sure that everybody had the resources that they need as an assistant, but I also led some classes. So I led, cooking classes. One class I led was cooking in the South Bronx. So I had cuisine, like Dominican cuisine, and, like certain chicken like that I made that was like, part of like the cuisine of like the culture of the South Bronx. I also led an island cooking class where I grilled jerk chicken, and people loved it. They were like, oh my God, I've never had Jamaican cuisine. And, I made rice and peas and jerk chicken. And they really enjoyed that. So, we had people from like China, Brazil, Portugal, Germany, Switzerland, India, just a variety of countries that came to Charlottesville and came to the International Center to learn and to enjoy experiencing different cultures, different cuisines, different language, different programs. And so that experience was really one of the best jobs that I had. Like, I really enjoyed it, especially because coming from New York, it's a diverse place. And I was so used to diversity, especially growing up in the South Bronx. I grew up around Latinos, I grew up around Africans, around, Blacks, around Caribbeans. So I had that, I was in a melting pot. And so to be at the International Center was a reflection of me. It was a reflection of the diversity that I experienced growing up in New York, and the enjoyment that I had in being able to socialize, because I am a social person. I love to talk, I love to interact, I love being a part of a community. And just being at the International Center allowed me to do that and allowed me to meet so many amazing people. I'm really good friends with some people to this day who attended the programs at the International Center, and I still keep in touch with my former supervisors from there as well.
Okay, that's dope. And yeah, I think like having the understanding or like just wanting that diversity in life, I think is a great learning experience, whether that's diversity here, whether that's diversity from people like away, because there's a lot of diversity, but just being around people that are different, that think differently from you, that have different cultures and different beliefs, I think is a huge learning experience. And I credit it to like a lot of where I am in my public health career, because I was born in New York, never like lived there, but grew up in Trinidad and Tobago, lived in the Middle East, and then came to the USA, went to Alaska, and now I'm in Winston-Salem, North Carolina. And like I've interacted with people from all over the place. I've interacted with people from like Russia who have never seen Black people before. Like they were pulling my hair and stuff, like a little girl who's like 3 years old. So I've seen a lot of different cultures, and like appreciated a lot of what life has to offer and what people have to offer. And I think that has like been one of my superpowers. But this interview is not about me, so let's get back to your story here. So you're also a UVA Panama Initiative fellow researcher, so tell me about that experience.
So I had a wonderful opportunity to do research on landfills and trash. I had a professor who taught in environmental thought and practice at the University of Virginia. It was a political course, and we ended up connecting really well. And she knew I enjoyed traveling, and I really was very passionate about just in general, just like people from marginalized backgrounds having to deal with certain disparities, particularly with trash and garbage and recycling and landfills. I found that a lot of the communities that were like considered like poor, they tended to live next to landfills or inherit all this trash. And so, my professor and I decided that would be a great opportunity for me to go to Cologne, Panama, to do research with the Smithsonian out there. So I did research under the Smithsonian, and basically I worked with them to really understand the politics regarding trash dumping, landfills, and recycling. And I collected a lot of data through interviews that I conducted with people that worked for the Panama Canal Authority, and particularly for like, the Smithsonian. Like I did a lot of research. I conducted interviews. I visited, the different places, that, dealt with recycling and dealt with like how trash distribution works. And so that was a really great opportunity for me, because it really allowed me to understand that every country is different in regards to how they manage landfills and how they manage trash. And again, like, recycling is really important. Like it's one of the best, ways to save the environment. But Panama had a different system in terms of how they recycled and how they approached recycling and how they approached garbage dumping. And so it really allowed me, being there really allowed me to learn about the culture, really learn about the politics and the system. And I got a lot of good information. Some information, of course, is confidential, but I really was able to get a lot of information from my research there. And it was a great opportunity to really learn about a different culture, work with Smithsonian staff, and just be in a different environment, which, because I enjoy traveling. So it was a great opportunity.
Okay, first question. Did you have to speak Spanish or is English okay?
I spoke a little bit of Spanish. I speak conversational Spanish, so I was able to practice speaking conversational Spanish, but I was around a lot of people who knew English as well. But I was able to practice some of my conversational Spanish. Was a good opportunity because I don't have a lot of opportunities to really practice my Spanish. So I really enjoyed being out there and speaking conversational Spanish with a few of the community members.
Okay, yeah, that's the best type of practice you can get. And yeah, environmental injustices are a very, very big thing here in the US as well as in all over the world, but it definitely does impact marginalized communities a lot more. And they've been forced to live in these kinds of places where they build whether it's a chemical plant or whether it's a landfill, whatever the case might be. So yeah, there's a lot of like research and still a lot of issues with that to this day. And then in your like asking you previously, you speaking about going to the Dominican Republic. What was that experience? Well, like because I don't have it like written down here.
So the alternative spring break, it was the opportunity to do community service in another country or in another part of the United States. And so I never traveled out of the country before. And I was like, well, I really want to take the opportunity to go to another country, particularly Dominican Republic, because I grew up around a lot of Dominicans in the Bronx. Mm-hmm. And I was like, I would love to experience that culture. Like I grew up around Dominicans, like I speak conversational Spanish, like I would love to practice my Spanish. And I really enjoy like community service. Like I really enjoy giving back. And so alternative spring break is at different colleges and campuses. Like it's an opportunity to do community service throughout different colleges and campuses. And so I took this opportunity to say, well, this is a great opportunity for me to go out the country. And it was great because I won a partial scholarship. So I was able to have some of my trip funded through alternative spring break. I submitted an application. I won a partial scholarship to pay for the trip. And I went to the Dominican Republic to do a sports camp and to do the dental education. And so those were the two opportunities where basically we went to DR, we went to a school and we went to a school and we did like a sports camp with the kids and we like played with them, we played soccer with them and, different tag games, like just really like being friendly with them and really showing them that Americans really do care and Americans, really want to learn about their culture and just have fun with them. But what really impacted me again was the dental education when we went to a different community and we weren't in a school, but we were in like a residential area in San Juan de la Maguana. And we were able to like speak with the kids about how to brush their teeth and just how to, take care of themselves. That for me was a great experience because I really felt like I was doing community service there because I was really giving them information that could be everlasting, that could last a long time and that was sustainable. You go somewhere and you're like, okay, I'm playing with the kids, they'll remember the experience, but it may not necessarily like have as huge of an impact as education where you're really giving knowledge and you're really showing a person how to change their health behavior and how to implement something that's long lasting, that's, long term, that can be sustainable. So for me, like going to Dominican Republic and doing the dental education was more sustainable because I was able to give children information that they could really use once I left the Dominican Republic. And once they, I would not see them again. I felt like I want to leave something with them that even if I never see them again, they can take this information and keep it with them forever and keep that memory with them forever. So that was important to me. So granted, again, I did the sports camp, I did the dental education, it was great. But I really wanted to give information to the kids. And I was really happy I was able to do that because again, they could keep that information with them forever.
Yeah, and I think that is highlights like the importance of health education and especially health education when you're younger to really build in those health behaviors as you grow older and just have reinforced positive health behavior in life. So you said this was the first time you left the country. So you did this before you went on the UVA Panama Initiative.
Yes, exactly. I went to Dominican Republic in 2011 and I went to Panama in 2014.
Okay, so what year was that, like your freshman year, junior year?
So Dominican Republic was in 2011, I was I believe it was my sophomore year.
Okay.
In 2011.
Okay.
Then the Panama trip was actually after college. So
okay.
It was actually after I graduated. So usually with the UVA Panama Initiative, people would do it during their undergrad, like they would find a way to do it during undergrad. But I had the opportunity to go to Panama after I graduated from UVA. I went in January and I went for a month in January 2014. So I went for a month. So I was able to, be out there for about a month. And I was working a job with AmeriCorps, but they were able to be accommodating, allow me to do the UVA Panama Initiative for a month because they said I would be able to catch up with my hours. So I worked it out with them and I, did the Panama Initiative for a month in January 2014. That was after college. So I already had my bachelor's degree by then.
Okay, awesome. All right. So you said that you wanted to be a doctor, you're studying biology, and previously you stated that because you went to this Dominican Republic trip, you didn't want to do that anymore. You're like, you want to do public health. But a lot of people at that point in time wouldn't even know that public health is a word, public health is a thing. How did you know public health is the thing that you wanted to do? How do you find that word, that thing, that place of study?
So I found out about public health really through more research. So I didn't have language to really apply or understand like what I was interested in. So I ended up doing additional study abroad opportunities. So after I went to the Dominican Republic, I really started understanding public health by taking a course in Costa Rica through James Madison University. And that's when I was really introduced to the term public health and really able to understand like, okay, this is the language I can apply to my interests and my experience. So it really, for me, public health, I started understanding it more when I was taking the study abroad courses through my university and through James Madison University. James Madison University was the first time that I actually studied abroad. Before I just went abroad and did community service, but to study, that was a whole nother sector and, opportunity. So I studied abroad in Costa Rica in the summer of 2011. And that was when I was really introduced to the term public health. And the course was actually under the student in public health. So that's how I was able to say, okay, this is public health. Okay,
awesome. And did you want to share? Well, thank you for sharing that, because I think that is probably a question, a thought that a lot of us have during undergrad. It's like, all right, we see that this is just like one-on-one, not really impactful in the way that we want to impact things, especially when we're going into like think about becoming a doctor, but we don't know about another way of helping people out in this type of like health related way. It's just not usually a word. Like public health isn't a thing that I heard of until scrambling to not get into Masters of Medical Sciences programs, and I wish I knew about it. I wish I was exposed to anything that said, look, public health was a thing, it was a field of study, it's something you could master in. I had no clue so I'm glad that you were able to do that. Did you want to like talk a little bit more about that experience in Costa Rica with James Madison University and studying abroad?
So in Costa Rica, I'll be a little brief about that experience, but I stayed in Costa Rica for a month. I was in San Jose and I studied the healthcare system. So we took a course that really, we were studying like how the healthcare system works in Costa Rica. And so we visited different health departments, we visited different clinics, and we kind of talked to, nurses and doctors about how they implement health in the city. And so that was a great opportunity. I was also able to practice my conversational Spanish. And I was also able to see how, Costa Rica works in terms of their healthcare system. Like what do they put more emphasis on in regards to, giving certain services to people. And we studied like the health disparities. And again, we were able to do interviews with like different doctors and nurses. And they were able to tell us about how they, approached clinical work. And in addition to that, we also talked about how they, had additional programs that did provide health education to residents so that residents could, be healthy and, live sustainable lives. So that was also another opportunity for me to study like the healthcare system. And it was great. It was a good opportunity. I really enjoyed Costa Rican culture. Like the people were extremely friendly, extremely nice. And it was one of my best study abroad experiences.
Okay, well, I'm glad that you got out there, and it's cool to see like the theme of you going abroad where you're also able to practice your Spanish, which is something I just like solidifies it going forward. And that's a skill that is definitely necessary, or not necessary, but helpful in public health, especially these days. So were there any other takeaways that you wanted to share about undergrad before we move on to the other parts of your journey?
Definitely in terms of undergrad, I definitely learned a lot about, myself and my interests. I learned about so many different opportunities. Like I learned that it's really important to take advantage of opportunities, especially when you come from like a marginalized background. One thing I can say is growing up in the South Bronx, like I grew up in a single parent household, and I was, considered like, socioeconomically disadvantaged, like, lower class, poor, whatever term you want to use. I grew up in poverty. And so when I got to undergrad, there were just so much opportunity, like just so many, opportunities to get jobs or to study abroad or scholarships or, networking events. Like I took advantage of all the free resources that the university had to offer, because I know that, once adulthood happens, I'm not going to have as much access to these free resources. And so I was able to travel to I've traveled to a total of 9 countries, but I was able to travel to about 5 countries minimum, just because I took advantage of the university paying for me to study abroad. I took advantage of the job opportunities by finding, work as a student. I was a full-time student working a part-time job at the International Center. So, I really took advantage of all the opportunities, because I realized that, you only live once, and I never had all of this access, in the South Bronx. Like I didn't have access to all these free opportunities for like studying abroad and education and, just learning. Like it was, it was a really great experience for me to be able to be in a university that had just, just opportunity, a huge opportunity for you to learn, for you to take advantage, for you to really grow. And so I was grateful for my undergrad experience, because there's some universities that don't have the funds to be able to say, you could go to this country for free or we'll pay for you. But my university, there were so many scholarship opportunities that I won because, I applied myself and I was really hungry for it. Like I really wanted to travel and I really wanted to learn. And so I'm grateful for undergrad. Like I took advantage of the mentorship with my professors, the programs, my job, the study abroad, like the people that I met. Like I really grew a lot, and I'm grateful.
Okay. Yeah, that's some great insights, and I think that is awesome. And also like people who maybe in high school listen to this, I don't know if there are any people, but like looking into schools that have those opportunities and have the funding there for you to take those types of trips, because that is, as you said, is opportunities that you're more keen to take as you're younger, as you're in undergrad. And as you also stated, you didn't have those types of opportunities in the Bronx, and you took advantage of all and every opportunity that they gave you, and got to travel while doing all of that, as well as practice your Spanish, which is, I'm learning more about public health and change your mind from biology to public health, which we all love here. So after you graduated, you said you did the Panama thing, you did AmeriCorps, and you also a diabetes educator at the Institute for Family Health. So how do you come across that, and then what do you do?
So the Institute for Family Health was actually an AmeriCorps opportunity. And so I applied for that.
Tell me more about the AmeriCorps, applying for the AmeriCorps process.
Yeah, so I applied for AmeriCorps particularly because I wanted to do public health, and AmeriCorps has some public health opportunities in New York. And so this position I picked because I was like, oh, this is a great opportunity to, provide health education. And diabetes, is definitely a reoccurring chronic condition that I've, witnessed in my own family. I witnessed it, with other residents in the South Bronx. And so I said, this would be a great opportunity for me to educate people on how to, prevent diabetes or navigate diabetes. And so I applied for, I stumbled upon an opportunity online through AmeriCorps, just typing up jobs, and I found, this opportunity. I was accepted, and, that experience was great because I was able to really meet different residents and be able to talk to them about their nutrition and how to follow the healthy plate model by the USDA, and just really focus on their eating habits and their physical activity habits so that they can reduce, their risk for diabetes or manage their diabetes. And so that was a great opportunity because I met a lot of residents where it was really like when I met them in the office, the clinical office, there was just a lot of opportunity for like casual discussion about, how could they, work with, what they have, how could they, eat more vegetables and reduce their craving for sweets, so that their blood sugar wouldn't go up. And so that was a really great opportunity. And then in that opportunity, I actually became Zumba certified. So I was licensed to teach Zumba. And so that was another great opportunity because I taught Zumba at the clinic. So in addition to providing diabetes education, the Institute for Family Health had funding to pay for Zumba licenses for the diabetes educators. And so I was a diabetes educator. They gave me an opportunity to, do the Zumba training. And so I was able to teach fitness classes to some of the residents in the clinic, which was also really fun because I love to dance. So I was like, oh yes, I get to boogie down Bronx, and get to, dance and, have fun with the residents and be physically active. So in addition to providing health education, I also provided some fitness education. And that was really fun. That was a great opportunity.
Yeah, that is dope. And yeah, it's always great that when you can like doing something as well as picking up on like other skill certifications like Zumba, and it's always a bonus that you like to dance and there's something that you're able to do with the residents there as well. That's awesome. And then you were also after this, you were the volunteer coordinator at the NYC Department for Parks and Recreation. And was the where was the AmeriCorps position? Where were you located?
AmeriCorps was both. So AmeriCorps AmeriCorps, the way AmeriCorps works is they provide volunteers for so many different organizations, so many different companies, nonprofits, government agencies. And so AmeriCorps was the Institute for Family Health, but it was also the New York City Parks and Recreation Department. So I did AmeriCorps for both.
And what did you do in that position?
So I was a volunteer coordinator. And so I managed over 50 fitness instructors and visited different fitness classes throughout the Bronx to make sure they had the supplies that they needed, to make sure they were placed at various community centers, hospitals, clinics, night shift facilities. I made sure that they had the resources for being trained to teach fitness classes. So I did all the documentation, I managed the database, I did outreach, contacted the fitness instructors, I edited flyers, and just really tried to promote the fitness classes throughout the South Bronx. The initiative was called Shape Up NYC. And so Shape Up NYC is an initiative where there are free fitness classes throughout New York City. And the goal of that is to really increase physical activity amongst New York City residents. And so I focused on the Bronx, particularly because that's where I come from. That was my borough. I'm passionate about it. So I was assigned the Bronx, and I managed the fitness classes and the fitness instructors in that borough.
Okay, thank you for sharing that. And yeah, it's cool that both these positions were AmeriCorps. And I think Biden signed in some more money for AmeriCorps in public health related type positions, but AmeriCorps is a great way to get your feet into public health as well. They have a lot of opportunities, like which you said, like as you said, in a lot of varied types of organizations as well. So during this time during your AmeriCorps, well, after all of the AmeriCorps positions, you decided to get your Master's of Public Health at, did I say it correctly? Is it CUNY? It's CUNY graduate
CUNY,
CUNY,
yeah.
You should have stopped me in the beginning, but no.
No, you actually said it right the first time, I believe.
Did I? All right. So you got your Master's of Public Health at CUNY Graduate School of Public Health and Health Policy. When you were doing the AmeriCorps, did you know that you wanted to go and get your Master's of Public Health, or was the thought process for getting a graduate degree in public health?
I definitely knew that I wanted to get my Master's in Public Health. I knew that I wanted to study public health a little more and be more in depth with it. In undergrad, at the time, there were not a lot of public health courses. They did have like some public health courses, but they were within the Global Development Studies department. And so I took a couple, but I knew that I wanted to learn more. And so the Master's in Public Health was a perfect fit for me because it allowed me to really dig deep into the science and the social determinants of health that you really need to understand in order to implement public health programs and do program management and so in education. So I knew that even when I was doing AmeriCorps, I knew that sooner or later I would pursue a Master's in Public Health. I knew that I would definitely take the opportunity to go back to school and really gain more knowledge about how to implement public health programs, especially in an urban environment. And so CUNY was a great opportunity because it wasn't a full-time program. So I had a lot more flexibility, and I knew I wanted a flexible program to be in. Like, I did not want to go to school full-time again. I said, okay, I did my full-time undergrad. Moving forward, I'm doing part-time so that I can have more freedom in my schedule and, you know, really take care of my responsibilities as an adult. So I pursued the Master's in Public Health part-time, and CUNY had a part-time program. And so I was able to take classes in the evening, and I took various different courses. Like, it was a really great opportunity to take what I was doing at work and really study it in a school environment. So that was an academic setting. So that was really, you know, beneficial.
Okay, and that's exactly what you're saying. Like, I think the MPH does give you like that leverage to dig deeper and build the skill sets needed to do a lot of like the public health work that is needed. Did you have a concentration for your MPH?
Yes, I did. My concentration was community health and social sciences.
Okay, and was there a reason you chose that concentration?
I chose that because community health and social sciences, there were a lot of courses that I was able to really study the social determinants of health. So I wanted to really focus on kind of like how people's relationships influence their health behavior. So how does communication, how does sharing knowledge, like how do, you know, policies, like social policies and social programs, like how do they affect people's health in general? And so I thought that community health and social sciences was really a good way for me to really understand the breadth of public health and really understand like how communities work when it comes to tackling health on a community level, and when it comes to understanding people's interactions and how their interactions influence their health behavior. So even, for example, with this pandemic, we see that we have to social distance. We can't be near each other. We have to be 6 feet apart. Again, that's part of community health. Like, our interactions with each other are changed or managed because we want to stay healthy in a certain way. And so you do realize that your interactions socially, or how you talk, or, you know, just what you learn from other people, that can influence your health behaviors. And so I definitely wanted to focus on community health and social sciences because I knew that the relationships that you have with people and how you interact, and the way, you know, society interacts with you, whether that's through the media, whether that's through education, whether that's through jobs. All of that being said, that all encompasses how you live your life in a healthy way, how you interpret health, how you embody health. And so I really wanted to be in a concentration that really, you know, tackled, you know, all of that.
Okay, makes a lot of sense. And then during your time in your MPH, you were a summer quest leader at Fordham's Liberty Partnership Program. So tell me a little bit more about that.
Yeah, so at Fordham University, I took the opportunity to, basically, I was kind of overseeing an academic program for high school students. So there were high school students that were able to take, you know, some coursework with Fordham University professors. And so I would sit in a classroom, assist them with any help that they needed on their assignments. And I would, you know, go on trips with them and, you know, really manage, like, you know, do classroom behavioral management. So like, if there are any issues or concerns, like, you know, I address those right away. And it was a really great opportunity because Fordham University is like a really good school. It's a really good university. And it's in the heart of the Bronx. And so, you know, the students, like, it was really great opportunity to like meet students from the Bronx and, you know, be a resource to them and be a support for them and be able to help them understand like their academic work and really understand like what, New York had to offer. So again, we did trips, I did academic assistance, sat with them during their lunch. So it was really great opportunity. It was pretty fun, and I did it for the summer. So it was a fun opportunity.
Yeah, and that also includes like them getting exposure to public health, and as also someone as an example that has done all these things and has gone to all these countries and taken on all these opportunities and sharing back with the community. So that is dope that you're able to do that. And then you're also a community health organizer at Montefiore. Montefiore Health Systems. Tell me more about that one.
So with Montefiore, it is a hospital organization based in the Bronx. And so Montefiore has a few locations in the Bronx. They have hospitals, they have clinics, and they have school-based health. And so I was in the school-based health program at one of the high schools. The school-based health centers and clinics, they're located in different schools, whether that's elementary, middle, or high school. And I worked at William H. Taft campus. So I worked at Taft High School in the Bronx. And so that opportunity, I was able to provide health education to high school students. I managed the Cooking Matters program, which was a cooking class for students to teach them how to cook the meals that they would usually eat in a healthier way. And I also taught sexual health and reproductive health education to students. So I taught them about consent during sexual activity, STDs, communication, relationships. And it was a really great opportunity to really tackle a new field because I've never done sexual health education before. So I was trained in teaching sexual health. I took trainings at Planned Parenthood, and that was a new world for me because I've never done sexual health education or reproductive health. So that was a great opportunity to really teach the high school students. I would go during their health education classes because they had teachers that taught health ed, and I would teach the classes while the health education teacher would like oversee and supervise and be behind the scenes. So that was an opportunity where I was in a high school, I was doing programs, I would do engagement chats to try to also increase clinical usage. So we wanted to increase the usage of the clinics. So I would talk to students about the resources that the clinic had to offer. We did a lot of STI testing, gave birth control. We did, asthma management. We managed, we also did mental health. So we had a mental health clinician that provided therapy to some of the students. And so I wanted the students to have access and know that this resource is here, this clinic is here for you. And we want to make sure that we're giving you as many tools as possible so that you could be a healthy student while you're here and take that, those skills and those knowledge with you, even after you graduate from high school. And so the engagement chats were an opportunity for me to go in the classroom, talk to the students about what the clinic had to offer. And then through that, we were able to increase clinical, clinic enrollment and clinical usage.
Okay, that's awesome. And on the vein of you saying that you had to like learn how to teach sex ed, what were the challenges in learning how to teach that, as well as what are the takeaways that you gain from being able to this other whole new domain of public health that you just learned to teach?
So for me, with sex ed, it was interesting, like learning it, because for me, like I never had a sex ed class in school or even in undergrad. And so it was a completely new field for me. Like even personally, it was new. And so for me, like I was, learning about like different terminology. I never even thought about consent and what that means. And, having enthusiastic consent when you're about to engage in sexual relations with a person. I never really understood the communication piece. And so I really for me, it was really fun learning, but I did have to make sure that I understood the terminology. I had to make sure that, I was prepared for some responses from students, because again, like some students, they may be comfortable talking about sex, they may not be. And so I had to be very aware of like the language that I was using. We even talked about like sexuality, like with LGBTQI. And so making sure I was sensitive to that and explain to students, how that works, and, how to be, accepting and accommodating of people that don't identify maybe with the same sexuality that you identify with. So I was learning a lot of information in a short period of time, but I am a fast learner. And so, by the time I learned the information, by the time I took the trainings at Planned Parenthood, I was able to really master, just how to teach a class and how to facilitate a program. And so some of the takeaways I have from that experience is really understanding that children have a voice in their health. And it was beautiful to really be in an experience where I was talking to students and some of them knew what I was talking about. Like, they were able to give a lot of feedback and have discussion with me and ask questions and be inquisitive and, explain their own personal experience regarding like sexual health and what they noticed. I was even able to correct some comments, so if I felt like there was, situations where there was like gender stereotyping, I immediately corrected that in the classroom, making sure that we understand, like, you don't want to shame a person for their sexual behavior. You don't want to shame a person because of their gender or their sexuality. Like, I was able to really correct and, make sure that, I explained, information so that it wasn't misleading. And so that, we were all like accepting of each other and creating an environment where we could, be safe and communicate in a safe way. So, for me, like my takeaway from that was you always want to create a safe space when you're communicating about health and when you're communicating about topics that could be triggering or that people may not understand. Like, you always want to make sure that you create a safe space for people to express themselves. And so that's something that I took away, is like making sure that whoever I interact with, whether that's personal or professional, especially in health education, that I'm creating a safe space for them to express themselves.
Okay, that's awesome. That's great takeaways, and I'm glad that you like shame on the system for not having things in place for you to learn about sex ed while you're growing up. And I know that's the case around the US for a majority of people. But thankfully, and I'm glad that you were able to not only like learn more about it, but able to give back and teach those that were in situations like you, but didn't have this kind of information. And as we all know, kids and young adults are going to have sex. So it's better to inform them about the proper ways and health positive ways to talk about sex and gender and all of these other auxiliary things. So thank you for sharing that as well. And then you were also a program coordinator at the Fund for Public Health in New York City. So tell me about that experience.
So in that experience, I worked within the New York City Health Department. And so the Fund for Public Health places, it's a nonprofit that places staff at different health department sites throughout New York City. And so I worked at the Brooklyn Neighborhood Action Center, and I worked with schools and their wellness councils. So I helped schools develop wellness councils and develop school wellness policies to ensure the health and well-being of children. And so I worked with school wellness policies and school wellness councils, particularly in elementary schools. And I helped, create opportunities for schools to, focus on policies regarding like fundraising, healthy fundraising. So making sure you're not selling like candies and chips, but that you're doing healthy fundraisers, such as, doing a walk to, increase physical activity, but raise money, or selling water and, having like healthy snacks in the vending machines. So, if you want to gain money, if you want to, gain revenue in the school, when you have a vending machine, you're putting healthy snacks in there and water instead of selling, sugary drinks or sweetened beverages. And so those were like the opportunities where I was really educating the schools on how to, overall increase the health and well-being of the children. We even, had policies where, we wanted to make sure that if students had access to recess, which recess is an opportunity to be active, that wasn't removed from students if they did something wrong in the classroom or if they misbehaved. We didn't want, physical activity to be removed as a punishment. So we didn't want to say, oh, well, recess, you won't have recess, because you did this behavior. We were like, no, there are other alternatives to discipline a student besides taking away their physical activity, taking away the opportunity for recess and physical activity. So we helped schools create alternatives to ensure that they were still promoting the health and well-being of students, but they still were getting the job done and making sure that the students' behavior was corrected. And so, we gave schools resources to ensure that they were implementing school wellness policies, and we, scored the wellness policies using the WellSat to make sure that students were hitting criteria so that they would, be addressing the various like nutrition and physical activity components of, the grant, because it's under the Creating Healthy Schools and Communities grant.
Okay, well, thank you for sharing that as well. And it also highlights like the importance of the policies that go behind like the health behaviors that people have access to, as well as, there's a lot of issues with in-school suspension stuff and out-of-school suspension stuff where they aren't really supportive, and they're really creating like trauma, like it's incentivizing traumatic situations, and like as you said, like reducing the access to recreation and all these different kinds of things. But that's some really cool work. And we need like school policies and all other policies and all other places to align with things that promote healthier behaviors, whether that is the marathon or not marathon, whether that is like the 5K run that they're raising money for, and or the healthy snacks in the vending machine. So were there any other takeaways that you wanted to share from the time in your MPH program?
Well, during my MPH program, I learned a lot in terms of like just community health, and particularly like urban health, and just realizing that, New York City has so much opportunity and so many resources. People just don't know how to access those resources, and people are unaware of what's available to them. And so it's really important to, increase awareness. I think, in order to make a decision, you have to be informed. And so making an informed decision really comes from, the tools and the marketing and the outreach that we're doing, in order to make sure that people know that they have access and that they can utilize what New York City has to offer. So I was grateful for my MPH program. Like we studied, a lot of, we studied New York City data. We studied the community health profiles that the New York City Department of Health developed, and we were able to really, understand like, how does New York City tackle public health, and how can we, as students, use the tools and knowledge that we have from grad school to really, have to be successful in the work that we're doing while we're in New York.
Yeah, that's awesome. And it is important that you do need awareness. You need to know that these options and opportunities and things are out there. And you also need to know that like these types of behaviors promote a healthier life and things like that. So you graduated from your MPH, and then you became a program manager at the Howard County Health Department. So how do you come across this, and then what did you do in it?
So it's very personal, that decision, because I decided that I needed to grow. And I think that being in New York, granted, I was born and raised there, and I did go to college in Virginia, but I decided to move back to New York. And personally, I felt like I was at a stagnant pace in terms of my skill set and in terms of my personal growth. And I decided that I needed to be somewhere else in a new geographic area. And so I decided to apply for jobs in Maryland, particularly because I have family that lives in Maryland, and because I visited Maryland tons of times, growing up, and I really like the state. And so I applied for the Howard County Health Department. I got the job offer, accepted the position. I moved to Maryland in June of 2018. And in that position, I was a program manager. So I facilitated health education classes, particularly in tobacco awareness. I helped to manage the Care App website, which is a resource website for people to have access to certain health resources in Howard County, such as housing or clinical services. And then I also, I did a tobacco awareness program for teens. I did the Care App website, and I also, supervised people as well. Okay,
yeah, that's awesome. And how challenging was that for you to take that leap to leave New York and go to Maryland?
It wasn't as challenging. I was ready for it. I was ready to experience something different. I realized that, I've been in an urban setting all my life, and for the most part, and I was ready to be somewhere where, my talents, could really be utilized also. And I could really focus on other communities besides, communities where there's a lot of, poverty or, marginalization. Like, I didn't want to assume that just because somebody is middle class or upper class, that they don't have health disparities as well, that they don't have health challenges as well. We can't always assume that just because a person has a socioeconomic class that, they don't have health disparities. That's not true. When I was at Howard County, I noticed that the students that I was educating them on tobacco because they were getting caught using e-cigarettes. And these were students from middle to upper class backgrounds. So their parents made a lot of money. They grew up in houses, 2-parent family homes, very stable, but they were doing behaviors that were detrimental to their health by smoking e-cigarettes. And so I really wanted to challenge myself to work in environments where there was a lot more socioeconomic diversity besides just, working in communities where there's a lot of poverty. I wanted to really, expand my breadth of knowledge and expand my skill set in communities where, again, health disparities affect people regardless of where you come from, regardless of your socioeconomic background or how much money you make or come from. So I wanted to really be a part of that newness and just really learn something new and, utilize my knowledge to really affect the community that I may not have come from or be a part of, but now I'm a part of it because, I'm in this health department and I'm teaching you something so that you can live a better life and make healthier decisions.
Okay. And did you also get the self-growth that you said you were missing, being like kind of stagnant in New York when you moved and reflecting on it now?
I definitely did get the self-growth. I was very comfortable in New York, just the socializing and, the hustle and bustle and just always having something to do. And then when I moved to Maryland, it was a slower pace. And so things are not as quickly done in, compared to New York, like, things take more time to get done out here. So I had to adjust to a new pace in terms of my work, in terms of my personal life. But it really taught me patience. It really taught me understanding. It really taught me how to really adjust and be flexible and be adaptable. And so I realized that in New York, what I learned and what I needed to know, it came to a halt. And being in a new environment like Maryland, I realized that I want to grow and, be in an environment that has a different pace, because that pace can influence what I'm learning and can really help me grow in a different way. So for me, that was the self-growth. Like I am still growing, and I'm really glad that, I took the opportunity to move from New York to Maryland.
Okay, awesome. Well, thank you for sharing that self-reflection. And then you currently work as a community developer at Prince George's County Health Department. So how do you come across that and what do you do in it?
So I came across that also applying, just putting myself out there. And, I realized that I wanted to challenge myself on a different level. So I was at Howard County for about a year. And one thing about me is I'm always looking to grow. Like, I'm a person that loves growth, that, can't stay somewhere for too long. Like, I have to keep growing. And so I decided to apply for that position. And it was another great opportunity. The only difference was in Howard County, I was working with children, particularly adolescents. And in this current position, I work with 18 or over. So I work with adults. In Howard County, I was working with a lot of like ethnically diverse communities. And in Prince George's County, it's predominantly African-American, middle class. So in terms of Prince George's County, like, I came up on an opportunity just, going online and researching. And I also lived in Prince George's County. So when I was at Howard County, I was living in Baltimore County, Maryland, but then I moved to Prince George's County, Maryland. And I was like, I would like to, like, kind of like being in the Bronx and like living in the Bronx, serving the Bronx. I was like, I would like to live somewhere and work there as well. And Prince George's County, I was like, well, I live there. How about I look for opportunities where I could work there as well and work with my people and work with my population. And so that's how I came about Prince George's County. Like, I was looking at what they were looking for. Like, they wanted somebody with, experience in health education, program management, chronic diseases. And I had all of that experience. And so I applied and I got the offer.
Okay, awesome, awesome. And then what kind of stuff do you do in your work now?
So right now I teach the Center for Disease Control's National Diabetes Prevention Program. So I work with residents who are at risk for pre-diabetes or type 2 diabetes, and I educate them on how to prevent their risks. So we focus on topics such as managing stress, shopping and cooking to prevent type 2 diabetes, sleep, nutrition, physical activity, finding time for fitness. So we focus on a variety of those topics. I also teach a diabetes self-management program for people with type 2 diabetes, along with a chronic disease self-management program. And that program focuses on a variety of chronic conditions. So that could be asthma, high blood pressure, also known as hypertension, type 2 diabetes, arthritis, like any chronic condition. And so I teach those 3 programs. And I'm also a website coordinator. So I manage the website campaigns that we do to increase marketing for our programs.
Okay, awesome, awesome. Well, thank you for that work that you're doing. We greatly appreciate it in this public health world. And then before I ask you, where do you want to see yourself in the future? What are some takeaways that you've had? Because you worked in 3 local public health departments. Well, what are some takeaways that you had from those experiences?
So working in 3 local health departments, I've learned that it's really important to understand that the public health is not overnight, meaning that like problems are not going to be solved overnight. Like it takes time to really get the resources that you need and educate people, and behavior change takes time. And so one thing I learned is that when it comes to behavior change, when it comes to getting programs into schools or just in general, like you're working with so many different community stakeholders. And so you really have to keep in mind that change is not going to happen overnight. Like you really have to be patient when you're implementing these programs. You have to be patient when it comes to, people changing their behaviors. Like you have to be willing to work with people because everybody's coming from a different background. And so just working in like local health departments, like I've learned, the politics. I've learned, that things take time, but I've also learned that it's very rewarding. So being part of these agencies that, utilize public funds to implement programs, like it's amazing because it's like the money that we invest in taxes is being poured right back into the community through these public health programs. And so that's why I enjoy working for the government, because all of the resources and money that's being invested through taxes or just through other funds is being poured right back into the community. So the community is not losing anything when they work with the health department or when we work with them. Like there's actually a gain and there's actually an exchange, and it's mutual. So everybody's benefiting, we're all benefiting from working with each other. We're all learning from each other. And that's why I enjoy working for local health departments, because we really take what the community pours into us and we pour it right back into them.
Yeah. And firstly, we need a lot more investment or reinvestment into public health, especially at the local level. There needs to be more investment. But I think that's important that you're saying that there are just takeaways from being in these local health departments, that people are at different places. There are different types of issues that you're going to have to deal with, and they take a long time. And I think it's important to know that a lot of the issues that we face as public health professionals have been systems that have been around for decades, if not centuries, that have set up things to be in this certain way. So it's not like we're going to change them just like that. And in the same way, it's very tough to change health behaviors that have been programmed into someone's just lifestyle. It's all about how can we get like positive lifestyles, and it's hard to change that when you're living in environments that don't allow you to have those opportunities. Okay, so before I move you on to the Furious Five, where do you want to see yourself in the future?
In the future, I really want to continue to be an agent of change in public health. I really enjoy public health. My grandfather always told me prevention is better than cure. So I want to really be a part of the generation that, educates people so that they can prevent future illnesses, prevent future health disparities. I want to continue to be a part of that change. So I see myself on a level where I can really impact not only the masses, but in the public, but also the masses in the government, the masses in different agencies, just really, really, really changing the trajectory of how we see public health in the community. And so I'm excited to be a part of that change. I'm excited to grow in my skill set, to grow in my critical thinking skills, my analytical skills, and just really in my care. Like, I care about people in general. And so I just want to be a part of the care and concern and just the health and well-being of society. And so I see myself continuing to do that and continuing to be an agent for change.
Absolutely. Love to hear it. And we look forward to following you along in your journey. So moving you on to the Furious five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
The main advice I would give is make sure that it's a personal passion, meaning that when you approach public health, you have to be ready to interact with the public. And for some people, I say that public health, and I say personal passion because, you know, when you're doing public health, there has to be some sort of genuine, you know, care and concern for the health and well-being of society. I think it's important to know that public health is a very sensitive thing, especially with COVID, right? Like, it's a disease, it's sensitive, people are being affected, lives are being lost. And so you really do have to care. You really do have to come from a place of, I genuinely care. I have a personal connection. And so you're interacting with a lot of people, you're interacting with a whole bunch of stakeholders and communities. And so you have to be willing to do that. And not everybody is a people person, you know? So not everybody wants to interact with a lot of people or educate a lot of people or really deal with different personalities when you're doing public health work. And so you just have to be ready for that. I think public health, you know, a person should really come from a place of, like, you know, wanting to understand people, wanting to have some sort of passion for the health and well-being of society. Like, I think it does need to come a little bit from a personal place, just as much as it comes from a professional interest as well.
Awesome. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
I would tell them to take advantage of as many opportunities as you can when it comes to wisdom and feedback. I say that because part of my growth has come from because I've been very receptive to the feedback that my colleagues have given me, the public has given me, supervisors have given me. So you have to be very willing and receptive to knowledge and to growth in order to be where I am today. You have to be willing to understand that things don't happen overnight. There's going to be some successes and there's going to be some challenges and failures, but either way, you just have to keep going. You have to keep growing, you have to keep learning, and don't give up. And so to get where I am, you have to come from a place of, I'm not going to give up, I'm going to keep going. And so that's the advice I would give.
Awesome. Number three, what's something you're working on improving in your life right now?
Oh my gosh, that's an excellent question. I am working on just enjoying my own company. Like, I'm such a people person. I love to socialize and love to work and interact with people that it's easy to forget myself. It's easy to forget, like, wait, I need to spend some time with myself. And so I think that for me, like, it's important to remember who I am. And so I'm working on, like, that self-regulation. I'm working on making sure that, you know, when I'm interacting with people, I'm managing my thoughts, I'm managing how I think about things, I'm managing my emotions. I'm really learning how to enjoy myself and be present with myself so that I can be present with other people. And so I'm working on presence. I'm working on being a present individual, living in the moment, while also thinking about the future. And just, again, being able to self-regulate and being able to make sure that through that self-regulation, I can be a successful person, not only in my personal life, but in my professional and academic endeavors as well.
Okay, awesome. Well, we look forward to seeing more of that. And then I think that is a challenge that a lot of us are also facing, but especially people who are very extroverted and like to be around people. Number four, professionally, do you recommend anything?
Professionally, I recommend when it comes to working, I recommend just trying out different work settings. Like I've worked in so many different settings. I worked in schools, I worked in small clinics, I worked with local health departments, which are part of, being a part of the government. And so I just recommend like really trying out different settings and really trying out different opportunities to just be a part of a part of different settings so that you can really learn about yourself and learn what it is that you like, what it is that you prefer when it comes to your work. When I recommend just not, putting yourself in one environment and getting comfortable there, like really challenge yourself to work in different settings so that you can increase your skill set and increase your experience in a diverse way.
Awesome. And last but not least, where can people connect with you?
People can connect me predominantly on LinkedIn. If you type in Jasmine Drake and you type in Prince George's County Health Department, you'll see that I'm the first person that pops up. In the picture, I have boxer braids, so 2 braids and a black dress. And so you'll see me on LinkedIn.
Awesome, awesome. I'll be sure to leave that in the description as well as the show notes for anyone that is interested. Thank you so much, Jasmine, for coming on and sharing about your public health story. I really appreciated it.
Absolutely. This was a wonderful, fun, enjoyable conversation, Omari. So thank you so much for having me.
It is my pleasure. So housekeeping items, everyone. Thanks for watching or listening to this. Be sure to subscribe. Be sure to leave a review and share it with a friend. It greatly helps the show get out to more people and help them navigate the public health career. And if you'd like to support, you can go to buymeacoffee.com/the Millennial, or you can go to the millennial.com/support. Thank you all and see you all next week.